Alright, welcome back to another lecture video. The first chapter that we're going to cover in our standard aesthetics book is going to be chapter 7, the treatment room. Our learning objectives for this chapter is to explain why treatment room preparation is an integral part of providing treatments, review the elements of an esthetician's professional appearance, outline essential room and station structural features, describe the ideal ambience, furniture, and equipment for facials, properly manage treatment room supplies and products. Also be able to set up for a facial treatment area, such as a facial bar or station, prepare the treatment room for services, properly clean and disinfect the treatment room, and perform pre- and post-service procedures to meet safety and health requirements. So setting up for our treatments that we do, super important because it's essential for providing a consistent, comfortable, relaxing, and clean environment for our clients. So overall, being consistent with it. Planning and preparing a well-stocked and organized room is necessary to function efficiently and provide a good service, so you're not scrambling around to find what you need. You know exactly where it's at. Complying with your state board regulations regarding the cleanliness of the treatment rooms secures your safety and your client's safety. And just overall, it will help you feel confident if you are organized and prepared by maintaining a professional and organized appearance, environment, and overall demeanor. Our appearance and our professionalism is going to reflect out on our business. It's going to affect how the school looks while you're in school. So practicing good hygiene and dressing professionally and then having an overall neat appearance will convey a polished image. Also, everyone appreciates working with someone who has a positive attitude. So this could be being dependable and having excellent customer service. Also, professionalism is included in being prepared. So taking initiative to plan enough time to set up the room, or also planning enough time to clean up the room is important. So it just makes things run more smooth. So the next time you're in, you don't have to worry about what's clean, what's dirty, where stuff is left, all of that. So very important. So a quick image checklist: having well-groomed hair, having minimal accessories, so minimal jewelry, nothing too long or dangly or large jewelry. Skin should be well taken care of because it's a testament for clients, so taking care of your own skin can have a positive reflection on how well you do in the industry. Also, well-groomed nails, so keeping our nails short and well manicured to avoid scratching the client. Makeup, so wearing what's appropriate for a spa or the salon that you would work at. Minimal makeup is typically best case scenario for when working in like what we're doing for facials and stuff like that. And well-groomed brows is appropriate. Proper uniform, so uniform should be clean and crisp. Wearing comfortable closed-toed shoes is also in accordance to state board guidelines. So for uniform, of course, we'll be wearing black scrubs when clinic time comes, and having a positive energy and a healthy lifestyle. So good posture, smiling, having good eye contact, and just a handshake with meeting people can convey a positive attitude and good energy. And then following with a healthy lifestyle, like drinking enough water, making sure you're getting enough sleep, relaxing when you need to relax, and having a good hobby. So kind of work-life balance a little bit in that. Our first question is, what makes preparing the treatment room important? The structural features that you want to keep in mind if you are going to maybe design a area that you want to work at, if you want to like build from the top up, is the size. So the treatment area should be large enough to ensure proper movement of yourself in this space without feeling cramped. Having proper ventilation, so proper ventilation ensures a healthy space for you and the client. And OSHA provides important guidelines as well. And air vents must be present, providing air input and output. Electrical outlets, so treatment rooms need to have a minimum of 4 separate electrical outlets, and you never want to use extension cords or multiple plug appliances within the room, as this can be a fire hazard. And also make sure there are no wires in your way or in the way of the client, because that could be a tripping hazard. Also, running water, so you have to have access to clean water, because in the work that we're doing, we have to have it for removal of any of the facial or body product that we have. We also obviously need it for hand washing and proper cleansing and disinfecting of our work implements or the work areas. If you don't have water available in the room that you're working out of, so if you're, for instance, in one of the private rooms, having a hot towel cabinet and 2 bowls of water will typically alleviate any need to leave the room during the facial treatment. So especially with the body wraps, when we do them in there, you want to make sure you have enough towels in your cabinet, because you really do not want to leave your client alone, especially if they're wrapped up during the service. Having washable flooring in workstation surfaces is pretty wanted as well, because carpeting and rugs can harbor germs and dirt. So having a workstation and treatment room that all of the surfaces are washable and durable is pretty important if you're going to design a space. So they should be either tile or stone flooring, or re-engineered wood, bamboo, or vinyl. And facial chairs and stools should be made of non-absorbent washable synthetic materials, which, like our vinyl stools, would be the equivalent of that. Having proper lighting as well. So adjustable lighting is needed based on the treatment that you're going to do. So for example, if you're going to be doing makeup, you need a combination of warm and cool lighting to make it so it looks more like sunlight. And maybe if you're just doing a facial, so if you're going to be in one of the private rooms, for example, there's some dimmable lighting where it kind of sets the tone of an ambiance, and having warmer lighting to kind of help relax. And uplighting provides efficient light but also creates the atmosphere. Question 2 is, what are the key structural features to look for in a skincare treatment room or area? Ambience is going to include the sight, the smell, the sound, and just overall feel of the spa. If it's inviting, if it's warm, if people look forward to coming to it, it's really going to sell your facility to potential customers and also bring people back. So super important part of being successful. So overall ambience, you want to engage all 5 senses to have a relaxing spa environment. So proper lighting to illuminate a well-designed spa environment. Right, I like to have like more dimmable lighting that's a little bit more warm in my treatment room, just because I find that relaxes people a little bit more than like the really bright fluorescent white lights. Having a good music selection that's relaxing but maybe not repetitive. If you want it to be relaxing, music selections, I believe, should be like less than 60 beats per minute is what they recommend. So a little bit more slow paced and not like super quick or anything like that with the beat. So very just like nice, soft, easy tempo. The temperature, so this would be the feel. So it's important to keep clients from feeling warm enough in the treatment room or properly cooled if it's hot outside. So it's going to depend also then on the timing of the seasons. The scent of the spa should be soothing and natural, and not just masking an underlying scent or of disinfectant or the lack of cleanliness in the establishment. So try to pick like pretty neutral scents if you're going to use like a diffuser with essential oil. I like to kind of season mine to different seasons, so I kind of have like a fall one going in right now because I'm looking forward to fall, which has like a little bit of cinnamon, clove, maybe orange in there. I don't know. It smells lovely though, and it just makes me want fall to be here, like immediately, but we'll see. And taste would be the last sense. So offering naturally flavored waters or a small healthy snack for a refreshment in the reception area can help promote the energy and well-being of your clients. It's also just like an extra boost of, this is kind of an extra bonus. Why not? Of course, why not? Makes people appreciate you a little bit more. Is something a little additional that you can do. So a checklist of furniture and equipment that you should always have: a treatment table. The book says it can also be called a facial chair, table, or bed. I would refrain from using the term bed just because it's like notorious, like beds are used for other things, and treatment table sounds a little bit more professional. Some of them are equipped to have adjustable heights, so like I was talking about having like an electrical unit part of it where it kind of lifts up and down. I typically would recommend that. Some have removable headrest, adjustable head and footrest, electrical controls again, and built-in electrical outlets. The aesthetics chair, or the esthetician's chair rather, or the stool should be ergonomically correct. It should be adjustable, comfortable, and it should be able to roll around easily without being super loud. And an incorrect angle can cause injury to the esthetician or the client. A step stool is always handy to help clients get on and off the table safely, and it should be stable, and you should always try to assist the client if they need it. Always offer a hand. A utility cart or a trolley to hold the tools that you're going to use, any supplies and products that you use, and this can be stationary or a roll cart like we have. And also a magnifying lamp or light, which is used to properly analyze the client's skin, as we know, and this gives a clear view of the skin and protects you from exposure to debris from extractions if you're going to do extractions. Also, it ideally has a circular bulb, a rotating head, and then a mobile base, so then you can properly angle where you need to angle the light. You should also have a steamer, which is a standard part of a facial procedure. You should make sure it's EUL certified. You want to clean it every day or after every client that you see, at least wiping it down with a disinfectant. You should follow the manufacturer's advice in cleaning it. And what the steamer does is it aids in deep cleansing and also kind of softens up the skin a little bit and aid with like the softening gel. And it should be performed before extractions. And you should not use it on sensitive or rosacea prone skin because it can just aggravate it a little bit more. Galvanic, high frequency brush, vacuum, and spray machines can be individual or multifunctional machines. Before using any of the electrical modalities, you need to remove all jewelry as the esthetician, but then also your client needs to remove all jewelry before treatments because it can interfere or cause some problems. And we won't really go into these as much until next semester, but just as like a little basic overview. Our towel warmer or hot towel cabbie or hot cabbie is what we use to keep towels warm and moist, and the towels are typically used just to remove product from the skin. Or also I like to use it to keep the water in the bowls warm. I only put the clean bowls of water in there though. Once you're starting to use it, I would take it out so dirty water doesn't get splashed in the towel cabinet. Also, if you even wanted to put a couple products in there, if they might be cold, like during back treatments especially, you could maybe throw in a couple products at a time so they're not getting like overheated for the entire session, because that can also affect how the product would perform if it's in there for too long. Waste containers for trash, specifically closed and covered waste containers, are fire retardant receptacles, which are just metal with self-closing lids, and a foot pedal is required for preventing contamination. So they have to be closed and covered with the foot pedal, so then you're not touching it between steps when you're working. Also, a closed covered laundry hamper is important for preventing contamination as well. And a sink or basin for water can be used to have access to clean water during treatments. If you, for some reason, need more water, I would just go to the sink and kind of get more water in your bowl. Just kind of rinse your bowl out real quick and then get more water if you absolutely have to. But try to keep 2 bowls of water on you at all times while you're working, just so you have access to additional bowl of water that's clean. Some additional items would be a wax heater, so an electrical warming device used for soft wax, paraffin, or hard wax application. And usually these are kept activated during the day for walk-ins or unexpected requests. So if you might take walk-ins, you would want to make sure it's turned on. During clinicals, if we have open availabilities, that might mean we can have an open appointment someone could take. So we would always turn on our wax. And then just remember, if we don't even use it, we need to make sure that we turn everything off, of course. An autoclave is this thing on the right side of the screen, and that's a sterilizer used for implements, meaning it's completely killing all microorganisms, including bacteria, fungi, viruses, and bacterial spores. And this is the only thing that sterilizes by pressurized steam. Reusable instruments need to be sterilized between treatments if blood is coming in contact with the implement. So since in Illinois we don't technically need to sterilize, we just need to disinfect. Technically we don't need an autoclave, but it would be something that you would want if you are potentially coming in contact with blood with your implements specifically. But if you don't have an autoclave, you may come in contact. You need to use disposable supplies to avoid cross-contamination. So again, it's not required in Illinois to have this, but it does ensure, if you wanted to get one, it does ensure that clients are getting quality and safe treatments. Other additional items would be a sharps disposal container. So we don't really have to mess with this because we can't puncture the skin, but it's used for it's a puncture-proof biohazard container that's used for disposable of lancets, syringes, or needles, and other sharp objects. And you would want to follow OSHA and state regulations for proper disposal. And not all facilities perform services that require a sharps disposal container, so we don't. In Illinois, you really shouldn't need to unless you are licensed and you're able to pierce the skin some other way. A small handheld mirror is also something that's nice to have, just to show clients before and after the treatment. Also, having a binder handy for your safety data sheets or your SDS. Your form should be kept in a binder or computer within the treatment room that's easy to access if you need to. Ergonomics is the study of adapting work conditions to suit the worker. So when setting up, you want to align your stool with the treatment table for the correct height and position that you're going to perform the service. A good stool with back support is important as well. The position of your body or your body alignment. So the esthetician's feet should be flat on the floor. Hands should be below chest level. So only your hands and arms should be touching the client, and maintaining a healthy posture. So being aware of the position of your back and remind yourself to sit up straight. Also just paying attention to your posture. The room setup should be comfortable for the technician to avoid strain on the hands, body, and back. So you should position your supply cart or the counter as close to the facial table as possible. And if you have to reach for a product or an implement or adjust equipment, you should get up out of the stool and you should not overstretch your back to reach for something. Some good self-care habits that you could start is stretching. So hand stretching between clients or before and after working is helpful. Just maintaining the health and flexibility of your hands and wrist. And then also stretching everywhere else, like your full body between clients after sitting all day. You want to make sure you're stretching between clients if you have time. The cost of starting your own business can be very, very pricey, especially when you have to buy big items that you may use for a long time, like the facial table or just overall other equipment that you might need on top of the product cost. So when you're estimating a cost, if you want to start your own business, you should break down everything that you're going to need and the costs associated with that need. You should also make sure to research supplies cost and equipment cost because the pricing is going to fluctuate from area to area, and being able to find the best price will be very important for you to save a lot of money. So check Amazon, check professional suppliers. I get a lot of stuff from Amazon because it just happens to be cheaper, or it's just maybe like the same price or maybe a teeny bit more, but if you get it next day, I get it next day. You know what I mean? So, yeah. Question 3 is, what are the 2 most important factors to consider when furnishing a treatment room? Managing your supplies is going to be a crucial role in part of your journey as an esthetician, especially if you're going to be working solo. So, having all the items that you need to perform services should be easily within reach, so you don't have to stop a procedure up to get up and find supplies, because your client won't be happy with that if it's super consistent all the time. It kind of just interrupts the relaxation part of the treatment if you have to get up constantly. Also, having proper inventory control is important to either help sustain your employer's business or keeping your own budget if you're self-employed, since supplies can be costly. And especially even at the school, we want to make sure that we're properly inventorying what we have. So if something's getting low, we need to make sure Leslie knows, so then she can make sure she gets that on a list of stuff to order, because there's going to be some products that you might really like and you might use on a lot of clients. So if we run out, we'll have to find an alternative, and we want to use what's best for our client's skin. So making sure that we have those in our back bar is crucial. Supplies can either be single-use or multi-use. Single-use items are disposable, so that's going to be our cotton swabs, that will be our cotton rounds, our 2x2s, our 4x4s, and those have to be disposed immediately after you use them in a closed covered trash container. Proper storage is also necessary for keeping items clean and sterile. So if supplies and products aren't kept at the workstation or the treatment room, they have to be kept in a dispensary or a storage closet. So our dispensary is our cabinets in the back of the room. And for proper inventory control, you should adhere to the spa's policy on removing items from the dispensary for stocking treatment rooms or stations. It's also important to always only take what you need for the treatment, and maybe just a couple extra. Don't like full on grab a stack of 4x4s, because once you take them out and have them at your station after that facial, they are done for. They are no good, because if you touched any amount of them on the top even, those are now contaminated, so you can't use them for the next facial. So again, implements are tools that are used to perform your services and are either multi-use or single-use. Multi-use implements are also known as reusable implements. These need to be properly cleaned and disinfected after use on each client or prior to use on another. Some multi-use implements would be a table warmer, a bolster, a handheld mirror, a pillow or a rolled hand towel for the neck, blankets, a bowl or basin for water, a client chart, the client's wrap for the client to change into, the facial kits, glass or plastic containers to hold cotton pads or other supplies that you might need, linen, so our sheets and face table covers, rubber mixing bowls, metal spatulas, retail product brochures, scissors, tongs, and tweezers. Single-use items are disposable and can only be used once. So this would be like the headband, although technically the headband we wash, so that's fine too. 2x2s, so aesthetics wipes, 4x4 aesthetics wipes, disposable hair wraps or protective caps, disposable lancets, which we can't use them, disposable nitrile or vinyl gloves, fan and mask brushes that are disposable, fragrance-free tissues, gauze squares, makeup sponges, paper towels, personal service towels to help drape the client and to keep the work area clean, plastic liners, sealable plastic bags, sterile cotton swabs, and wax supplies. Also, with facial treatment supplies, of course, we need our products. So products are the main thing that we need to perform any service in the aesthetics industry. So having the correct products on hand for all clients is good. Question 4 is, why is it important to stock and organize supplies prior to treating your clients? So there's something called a facial bar or station, and these are just treatment areas within typically the reception area or the retail area, and located within 20 feet of the front door just to allow for maximum of visibility. And a lot of the time with these, you would only be doing an express treatment or a mini treatment or facial on someone because the client wouldn't be disrobing, and you would kind of keep the longer treatments in a private area, or any peels or full facial, full body treatments, or anything that's going to have extractions would not be in this space. The facial bar or station consists of a workstation, or there could be several workstations that are set up with all of the items and products that would be needed. And stations should all be fully supplied to ensure smooth transitions between clients and maintaining a clean environment. So you should always have a facial chair, magnifying lamp, consultation chart, unscented facial tissues, gloves, wipes, headbands, hand sanitizer, spatulas, garbage cans, rubber mixing bowls, small bowls, bottled water for quick water changes, handheld mirrors, makeup sponges, facial cape, cotton swabs, a trolley or workstation setup with all of the products that you would use. When preparing the treatment room for the services that you would be doing, you can have a mental checklist to make sure you have everything that you need for whatever service you're going to be getting or giving. Also, knowing what your schedule looks like is important to know what you would need for any of the services that you would do that day. So you can take a look at the schedule in the morning for, say, a clinical day or a day that we work on each other even, and see how many towels will I need. You can just go ahead, make them, and put them in the hot towel caddy at the beginning of the day, because that will save time throughout the day, knowing that you don't have to make them again between clients. Also, having your client's chart notes on you, if you know what client is coming, having that ready to review and to write down any soap notes that you might start. And as a guideline, it should take approximately 10 minutes to set up for a service and 10 to 15 minutes to clean up after a service. So once you've gathered what you need, you can start setting up. For single-use items, they should be kept stored away and covered to prevent contamination. You should retrieve them after you washed your hands, and you should only dispense the amount that you need for the service. You can use tongs to retrieve additional supplies during the service if the supplies is right next to you. Otherwise, you should take off your gloves before you go grab more disposables if you need more disposables to prevent contamination of that area. Single-use supplies should be set on a clean towel in the order that they'll be used, or a disinfected surface. And you should not put clean or soiled supplies on the base surfaces, so they need to be immediately thrown out if they are single use. and you should dispose of contaminated items in a covered waste receptacle. When you arrange your products on your station, you should set them out in order of the procedure that you're doing. So for facial, you would of course do the proper, based on the client's skin, proper cleanser, exfoliant, massage, lotion, mask, toner, etc., moisturizer, all of that. Any product that you might use on them should be based determined on the client's skin analysis. For the dressing area, some general guidelines are to have arranged a place for the client to sit while changing, have a clean robe or spa wrap hanging on the hook of the door or folded in a small table for the client to change into, get some water or tea ready for the client, and have the client chart and release form prepared for them. Remember to explain to the client where to put their personal belongings, including the jewelry, purse, and how to put the spa wrap on. Never touch the client's jewelry or assist them with the removal of jewelry. I'll disagree with this one because the book says not to do that, but I always like to assist people if they need help with it. I see no harm in it. Just make sure you place it where they can easily get it after they're done. Explain to the client how to get onto the table and where to position their head. Also explain exactly what clothes need to be removed and how to put the facial wrap on. So this will vary from treatment to treatment, but typically I always recommend just to get in the habit of having clients put the Velcro in the back for the spa wrap, just so if you ever do a back treatment on them, they're just used to having it on, or you're used to mentioning it. For facial bar, that's a little easier setup because the client's not going to remove any clothing. Also, some clients may not have had a facial wax or wax service before, and they don't know exactly what they're expected to do, so it's very important to give specific instructions on how people should start or what they should remove, especially. Question 5 is, what are a few guidelines to follow when setting up single-use supplies? And after you complete your post-consultation with the client, you want to make sure that you record the client chart notes and write up retail sales. Before I do any of the soap notes though, I prefer to start with my disinfecting and my just cleaning and disinfecting the treatment room beforehand. So while the stuff is in the disinfectant or in the barbicide, that's typically when I would do my soap notes because the stuff has to sit 10 minutes anyway, so may as well start with that, get that going, and do soap notes, because if it takes me 5-10 minutes to do those, by the end of that time, after I set up everything, typically it's ready for me to take out implements from the barbicide so I can rinse those and set those out to dry. Hopefully by now we know how to clean and disinfect everything that we use, including our treatment room, our table, our equipment that we use, and then all of the implements that we use. But in addition, some other things to keep in mind is to make sure that you're wearing gloves for all procedures and wash your hands after completing any infection control procedures. Wash and disinfect all synthetic brushes, tweezers, and non-disposables. Change the disinfectant to comply with the manufacturer's direction and infection control regulations. To avoid cross-contamination, you should roll the U side of the linens and sheets inward into a bundle. You should turn off the table warmer if it's used. Clean the wax machine, so turn it off and unplug it at the end of the day as well. Disinfect the steamer and magnifying lamp. Disinfect the bottom of the tray and inside of the towel warmer after removing all of the items. Disinfect any other equipment that was used and turn it off. Clean all of the containers and wipe down any dirty product containers with a disinfectant. And clean all counters, sinks, surfaces, and floor mats with a disinfectant as well. With single-use items, you should place your soiled gloves and extractions items in a covered waste container. While the single-use items are in use, place them on surfaces that can be disinfected or disposed of, like a paper towel. Keep all your clean supplies separated from the used ones. And if you ever move into an area that you can use lancets, any of those disposable lancets should go in a sharps container. And you would want to make sure you check with OSHA and the state rules for proper handling of the sharps. For the end of the day cleanup, estheticians or students even are responsible for the cleanliness of the treatment rooms, so technicians should always be prepared to clean up the areas that they use. Make sure you alert me or a manager about the areas of the facility that might need repair or a deep cleaning. And also, cleanup procedures are regulated by regional laws, so be aware of those guidelines as well. Now, I won't go into much about the pre-service treatment protocol in the book, but it is on page 285 to 290 for the pre-service preparing the treatment room, and it is procedure 7.1, so I would encourage you to look at that. Also, same thing with the post-service or cleanup in preparation for the next client. This is procedure 7.2, and it's on pages 291 to 294. So the learning objectives that we went over explained why treatment room preparation is an integral room and station structural features, described the ideal ambience, furniture and equipment for facials, properly managed the treatment room and supplies and products, be able to set up a facial treatment area such as a facial bar or station, prepare the treatment room for services, properly clean and disinfect the treatment room, and perform the pre and post service procedures to meet safety and health requirements. And that will officially conclude our chapter 7, the treatment room lecture. Thanks for joining me.